Welcome to another episode of Wild and Well. Today I'm talking to bloating and constipation coach Allison Jordan. She's also a functional diagnostic nutrition practitioner and craniosacral therapist. And we're going to be talking all about acid reflux. So, welcome, Allison. Thank you so much for coming on today. But before we get into it, can you tell us one thing that you did today to take care of yourself?
Ooh, I didn't know this was going to happen today. Well, today is my birthday. Is that kind of crazy on the
Oh, happy
recording?
birthday!
I know, what a great day to record a podcast. Um, and I have a free Starbucks. I'm a Starbucks girl. I don't know. I sometimes I'm like, would people look down on me as a health practitioner? It's like, I don't see it affecting my health. So with how I buy and what I buy, I had my husband go to Starbucks for me and grab my free drink for the day, which is a matcha latte with almond milk.
Oh, yum. I love matcha.
So, yeah, that felt like self-care.
So, can you share a little bit about yourself and what it is that you do?
Yeah, so I'm a functional diagnostic nutrition practitioner and I specialize in gut health. So, anything that the gut impacts, which it is actually the whole body, is what I specialize in. And I kind of backed into this because I got sick. Back in 2015, I had graduated from college. I was in my first job, which was not health related at all. And I got so sick. I couldn't poop. Constipation was a big issue. I got a couple like labels, diagnoses. IBS was one of them. I was just nothing helped. Probiotics, uh, you know, take like diet change. The low FODMAP diet was what I ended up kind of sitting on for the longest, but it didn't really like get rid of all my symptoms. It just helped reduce them and mitigate them. It didn't like heal me by any means. I tried breathing, meditation, yoga, anything I could think of that was I changed my job. My doctor was like, maybe you're stressed. I literally quit my job and I was like, I will go all the way to get rid of this problem. And that didn't make it go away. And so I was like, what is going on? I was doing all these blog reading and research and was doing actually research using the University of Michigan medicine because I had a friend who's a lawyer and she had access to all the archives that like a upper graduate student can upper level like student can get at the University of Michigan. And I was just like, nobody had good answers on IBS. Nobody had good answers on constipation. It was like, eat fiber, drink water, take magnesium, and nothing improved. And I ended up figuring out things that helped me and kind of roundabout way became a massage therapist. Thought, would any of the things I learned that helped me help other people that I could practice within my scope of practice? And yes, they started getting better. My clients would be like, oh my gosh, my bloating was way down after our appointment. And I was like, this is really interesting. And eventually got additional training as a functional diagnostic nutrition practitioner to do advanced functional lab analysis and create protocols for people. And we've been working with clients all across the world. We've had clients in Australia and UK and Canada and Germany. And so we work with clients all across the world to help with gut issues that their doctors weren't able to resolve.
That's incredible and amazing that you can work with people all over because often with testing, that can be really tricky, can't it? Like
It's a
test for different.
logistics. Yeah, it was like a logistics puzzle. Like, can we figure this out? Because we kept on getting questions because podcasts, people can hear them everywhere. So I have a top 1% global podcast, the Better Belly podcast, and we have people listening from everywhere. And they would email us and say, can I get this where I live? And we're like, let us go check.
That's incredible. So, can you talk to us about acid reflux? This is something that I think affects so many people. I know it's affected me during pregnancy, and funny enough, in the last couple of months, it was something that's been coming up for me as well. Even though we talked about booking in this podcast months ago, it wasn't something I personally experienced often, and then I started to. So, I found that particularly interesting. But can you talk to us about what acid reflux is?
Totally. So acid reflux on like a very just like mechanical level is acid from your stomach exiting and somehow escaping the actual stomach lining, which is it. Your stomach's designed to handle stomach acid. It is happy with it. It's actually less happy if you don't have enough acid in your stomach, but that acid somehow gets into your esophagus and it can come very high up and cause sinus issues. Like a lot of congestion can sometimes be because of what we might call silent reflux, where you're not getting the traditional heartburn, burning throat, like sensations, but you could actually have, a lot of postnasal drip, chronic congestion can actually be acid reflux. Basically, that acid is getting into places and onto tissues that are not designed for high amounts of acid, and it is uncomfortable. Um, of course, then the big question becomes, why is that acid escaping? What is causing all that failure? And interestingly enough, most of conventional medicine's approach to fixing that is just, well, let's just tamp down the acid. Let's give you a PPI. Let's give you an antacid, um, and try to, neutralize or reduce the amount of acid in your stomach. And while that can be really good short-term approach, it doesn't actually address the root cause because no one should be getting acid reflux. Like the way that God designed our bodies, the way that our bodies have been created or designed is just that doesn't happen. So really it's just about poking holes into an individual's body and be like, okay, what's enabling this acid to escape where it should be?
And what are some of those reasons that you see in patients that you work with?
Totally. Glad you asked. All right, this is the juicy stuff, guys. So, if we want to think about acid leaving the stomach, one of the first places I actually like to start is literally on a mechanical level. So, the stomach hangs out right underneath the diaphragm, and it has something called the fundus of the stomach, which is this like bulb. Think of like a balloon. The top of the balloon's nice and rounded, and the exit of the where the esophagus meets the stomach is not at the very, very top of the balloon. It's to the side, kind of where the stomach starts to slope down. And so as we have acid interacting with food in our body, we have air that should come up to that fundus and then we can burp it out. But if there are restrictions in your tissues, and by restrictions, I mean the tissue doesn't move the way it should. It's instead of it being a stretchy rubber band, it's stuck in certain areas that we're really talking about fascia mostly at this point. But if there's adhesions where the muscle or the organ isn't moving or gliding the way it should, or the diaphragm isn't moving, if there's adhesions anywhere above or below the diaphragm, and this is really key, above or below, then the bag of the stomach, the opening where the esophagus meets the stomach, it can't close. That's called the gastroesophageal sphincter, or sometimes called the cardiac sphincter, because it's really close to the heart. And that's one of the reasons heartburn can be a symptom, can be, isn't required. I actually had acid reflux really, really bad, and I had silent reflux. So it was only discovered when a upper endoscopy was done to look at my vocal folds, because of a like breathing issue I had, totally unrelated to asthma, not asthma, but they said, "Oh, you have acid reflux," and I was like, "Really? I have no idea." I was like 12 at the time, and they're like, "You don't get heartburn? Nope. You don't. Your throat doesn't burn? No." Anyway, so heartburn though can be caused because that cardiac sphincter or gastroesophageal sphincter is close to the heart, and the heart will get little like nerve signals that will start to send out of like something's wrong nearby us. The organs are very sympathetic to each other. That's a really beautiful part of the body. Um, but all that being said, number one thing is that there's restriction. So my background, the very first thing I did before I did was a functional diagnostic nutrition practitioner, is I did something called visceral manipulation and craniosacral therapy. And there are types of manual therapy that not like one type of practitioner does. It's not like go to a chiropractor to see this, go to a massage therapist, go to a PT. No, it's actually all these different therapist styles could choose to learn visceral manipulation as like an add-on skill set. And so I had chosen to learn this as an add-on skill set, because I actually received it. It was one of the things that helped me overcome my chronic constipation and IBS. So I was familiar with it from an IBS bloating constipation standpoint, but it's visceral manipulation. It can help. Viscera is like another word for organ, and it can help all the organs move and rotate the way they need to. So, if you want to know a little bit, I almost want to stop it there because you could go really deep in this. And I actually do go super, super deep onto the concept of the mechanisms and the anatomy. If people really want to know about it, it's really cool, on how fascial restrictions induce acid reflux. And I go into an episode 91 of my podcast, and I can totally give you that link so you can have it in your show notes. But it's called the fascia solution to acid reflux. And I've had a handful, very few, but a couple clients who only needed visceral manipulation to eliminate their acid reflux. I say typically acid reflux is a multi-layer issue where there's like not just one thing going on, but in a handful of situations I've had that just be the only thing someone needed to get rid of it.
So with that, if somebody has that sphincter causing issues, is this something that you would look at? Because sometimes people are told, oh, they have to have surgery if that's not working properly.
Oh, right. I've totally had clients told that they need surgery and then they've come to see me and we work with them and they don't need surgery anymore. Yeah,
Wow.
I've actually had someone with gastroparesis, which is like it can cause a ton of acid reflux. It is not like if you have acid reflux, you don't have gastroparesis. But gastroparesis is a fancy word for like paralysis of the stomach. The stomach just like isn't moving. It's moving so poorly that we're just going to call it paralyzed. And so she came to me with gastroparesis and the doctor had said, "We can't do anything for you. You are stuck this way." She was on 2 PPIs in the morning and 2 PPIs at night. I mean, insane amount of acid reduction. She was miserable all the time, like daytime, nighttime, when she ate meals, when she didn't eat meals, when she was sleeping, when she was upright. It didn't matter what she did. Nothing could help her acid reflux. And with her work with us, she started working with me before I knew how to even do functional medicine lab analysis or protocols. And it was just visceral manipulation. And she was down to 1 PPI a day by the time we had done about a year's worth of sessions.
Wow. That's
Yeah.
incredible.
So, I mean, but a little bit of a hint or a little bit of an insight. One of the reasons that sphincter can't work, I want you to imagine, do you know, like on a water bottle, there's some water bottles that are designed, you have to like bite the water bottle, like mouthpiece for it to then suck water up. So you bite it and then it goes from like this closed, like two pieces of rubber that are touching each other. Then you bite it and they open. Well, that's the same thing that can happen to the gastroesophageal sphincter is it has a lid that should go on it, but if it's getting pinched because there's a lot of tension around it, either above it or below it, so above it can be restrictions in the thorax. So this client who had gastroparesis, diagnosed, that was the diagnosis from the gastroenterologist. She had about 6 months before this diagnosis gotten into a car accident where she was thrown from her motorcycle onto her left side. And she knew she had like gotten injured from it, but it was only about 6 months later that everything in her left side, she had frozen shoulder on her left side as well, where her left arm didn't want to lift. Well, all of her fascia in her like lung pleura, these are all like layers of tissue that are in your body. But if you guys know where your rib cage is, that's where your lungs are. So between her left shoulder and the bottom of the left rib, like if you guys feel where the bottom of your left ribs are, that's where all of her adhesions were. Well, your stomach's right under the left side of the rib cage. And so her diaphragm couldn't function properly because her lungs were all stuck from the lung pleura higher up into the closer to the arm. So we released that tissue. Not only did her frozen shoulder go away, which the PT 18 sessions of PT had no improvement on, but also her acid reflux dropped. That was the first time that she was able to reduce her PPIs from 2 pills in the morning and 2 pills at night to just 1 pill in the morning, 1 pill at night.
It's life-changing.
Yeah, that was in our first 2 sessions.
That's a win.
Yes, right. So she had totally been told like this can't be changed except for with surgery. And it's not that like there are things that sometimes when the client's consulting with me, I'll be like, you know, that might not only that might only improve with surgery, but there's plenty of things like DRAs, which this topic is not on, but diastasis recti. Abdominis, when a woman after pregnancy, when the two sides of her abdominal muscles don't come together, I've had tons of clients who avoid surgery and mesh implants with that, with doing visceral manipulation.
That's very cool. That's actually a podcast interview I'm recording tomorrow is all about that. So, yeah. So, what are some other causes of acid reflux? There's that like more mechanical side of things
Yeah.
that you're talking about. What else causes it?
So here's another big misnomer. Low stomach acid is actually a big cause of stomach acid. And actually, I've been really pleased that since I first started sharing this on the podcast in 2020, I'm actually starting to see more people talk about it. So you might actually have some listeners who are more familiar with it. But the mechanics of it behind it are this. You're like, why would I have acid reflux if I have low stomach acid? Well, the big thing is that you need stomach acid to digest food. And if your body isn't getting a good enough quality digestion of the food going into it, your body will keep around that stomach acid or keep around that food in your stomach. The pyloric sphincter, which is the exit of the stomach. So we just talked about the entrance being an issue. Now we're talking about the exit. The exit of the stomach has cells around it that tests how acidic the contents of the stomach are, and it won't release it until it has the right acidity. If it's not acidic enough, it will actually say, wait, this thing needs to digest longer. Well, now you have this food hanging around the stomach, not being digested. It's really low stomach acid. And because it's this balloon that's just like holding food, it really should be emptying out. And so whatever is in there can end up kind of being regurgitated in this system it's not high enough. Another theory we have, and this is a really interesting theory. I've seen it once or twice. And when I say theory, it's like, I don't know if they're waiting around for more testing or whatever, but it's that when you have stomach acid and it hits food, some air should be created, right? It's like if you have vinegar and baking soda and you mix them and they bubble, right? When stomach acid hits, we're going to have some foods that don't create air, but we have some foods that are going to create like a fizzing effect. That should create a little bit of air that goes up to that fundus, the top of the stomach, that balloon part, and then we can burp out. But if we're not getting, they think that that air at the top of the fundus might actually be part of proper action in the gastroesophageal sphincter, that you need almost a little bit of tension in that fundus from a little bit of air to keep that fundus. So that's actually back to mechanical again, but it's how low stomach acid might cause a mechanical issue. And so that's not a visceral manipulation solution. Now it's how do we actually help resolve the low stomach acid? And I'm actually not a huge fan. This is controversial, but for clients with low stomach acid, I will never add stomach acid to their body until we do one thing. And this is very important because it's very common that people say, well, let's drink lemon water, like hot lemon water in the morning because lemon juice is acidic. Or I'm going to do a apple cider vinegar, shot. These are ways to like very naturally not using a supplement, but using food, increase the acidity of our stomach. However, I've seen this backfire really, really bad. And the main reason is because of a pathogen, aka a bug that shouldn't be in there in your body or shouldn't be acting badly, let's say, that can be in the stomach. And it can create low stomach acid and it can create acid reflux as like a symptom. And that pathogen's called H. pylori. Have you talked with H. pylori with your audience much? Cool.
No, no, I
So
don't think it's come up at all.
here's some details on H. pylori. H. pylori is actually one of the reasons it doesn't get talked much about by doctors is that there's research in conventional medicine that suggests H. pylori is not inherently pathogenic, meaning they've done research and they've taken like 100 people who may or may not have acid reflux, and they test them and see if they have H. pylori, and they have found a bunch of people. If you do this research, if you do this test of asymptomatic or even symptomatic people, you can have H. pylori and have no symptoms, essentially. So they decided that H. pylori is only an issue if it's over a certain amount. And just very few doctors test for it. I don't know how that happened, but I get very few clients who have acid reflux who've even been tested by conventional medicine. But the second issue is that maybe they have been tested by conventional medicine, but I don't know if your listeners are familiar with this, but a lot of tests that doctors do in like a hospital setting, when you get the result, it doesn't give you a number of like how much was found. It'll say positive or negative. Just to make it really simple. Well, positive or negative when it comes to H. pylori negative doesn't mean there's none. It means it's under the threshold they think is an issue. So I have clients who have a negative test from a hospital system that we then test them with our functional lab tests that actually gives you a number instead of just saying like positive or negative, and it's there. Maybe it's not as high of levels, but if someone has acid reflux and they have H. pylori, I don't care if it's high or low, because also those samples can sometimes be off. Like your samples might not get as strong of a presence just because of where you scooped or where you grabbed the amount from. Also, H. pylori tests, I'm talking mostly in terms of stool testing. There is breath tests, or just like a straight up biopsy. If they're already down in the stomach, they might take that. H. pylori is really, really highly prevalent in ulcers, but basically You can have H. pylori without having an ulcer. And if you have acid reflux and you add acid into an environment where there's H. pylori, you are feeding the pathogen and you will get more acid reflux. Have you seen that with any of your clients? Like, I don't know how much you do with like adding, like, whether it's betaine HCl or lemon juice, or do you do any of that with your patients?
Yeah, it seems like a very common thing that people have the lemon juice in the morning. And for a lot of people, that seems to really work well. But that's an interesting point that you bring up that you'd want to do that testing ahead of time to make sure that if you are choosing that path, it's appropriate for that person and not just
Yeah.
feeding the pathogen. So
Yeah.
if we do that test to find out if we have H. pylori, after that, would you recommend that people do supplement with something like a stomach acid, HCl, or the
Yeah.
vinegar or the lemon juice if they test negative?
If they test negative, then they're clear, free and clear for that. And if they test positive, you do want to do a protocol to get rid of it. We do an herbal protocol that's 1 month. You don't need, prescriptions. And I've hit or miss actually, like hit or miss good, like will a prescription or, antibiotic get rid of H. pylori or potentially just cause more problems. But um, the, yeah, the once you get rid of it with a protocol, or if you have it negative, then you are clear to add stomach acid in. But now you get to the next layer. And before I get to the next layer, I will say if anybody wants more information on H. pylori, it tends to like perk people's ears up if they like know they have the diagnosis or have been tested and got that negative test. I have a whole podcast episode that's like my master episode on H. pylori. It's episode 233, and I will also get that to you. Um,
Yeah, that's great.
yeah.
I'll put that in the show notes along with all the
Yes.
other ones that you mentioned.
It's very juicy. But next thing is if you just start adding stomach acid to the stomach, you still haven't solved the problem because ideally, like, why is the stomach not creating enough stomach acid? If you don't have H. pylori, you can't blame H. pylori. If you do have H. pylori, I'd say when I have clients get rid of their H. pylori, probably only as high as 5%. It's a very, very low number. Do they suddenly all their acid reflux goes away? So that'd be another misnomer is expecting an H. pylori protocol to solve all your acid reflux symptoms because you still might have low stomach acid after getting rid of it. That's the most common thing. So the most common reason I see clients have low stomach acid is zinc deficiency. And zinc is a important mineral we need to create stomach acid. And there's a couple ways that I like to test stomach acid, both stomach acid itself and one marker I like to look at for zinc. Because I find that blood zinc is not like zinc markers you get from a blood test is not like trustworthy when it comes to related to stomach acid. But the marker that I see super correlated is alkaline phosphatase. Yeah, I know, crazy. Alkaline phosphatase, for a functional medicine level, you want it to be above 70. And for a lot of my clients who are have low stomach acid, many of them, I don't even bother getting this marker because I have other ways I can kind of deduce that they have low stomach acid. But if I kind of want to double confirm it, or if I happen to have their blood work, I'll be like, look, your alkaline phosphatase is 60 or 50 or 40. My client with gastroparesis, her alkaline phosphatase was 40. And she'd already paid thousands of dollars to a functional medicine doctor in our area. And he marked up the whole page of blood work with all his notes. And he didn't touch alkaline phosphatase. And I was like, well, you've got low zinc. Because you need zinc to create alkaline phosphatase. It's related to other things. Like you might know it's related to bone growth, but it also can be low because of low zinc in the body, like at a cellular functional level. So when you have low zinc, that's the most common reason I see. And the reason for the low zinc is because you need stomach acid to absorb zinc and you need zinc to make stomach acid. So it's a catch 22. There's a bunch of other minerals we need stomach acid for. Calcium. So calcium deficiency, or women who are struggling with osteoporosis, osteopenia can be a low stomach acid issue. So when we're looking at like acid reflux, I'm also looking at do they have osteopenia, osteoporosis? Like those can be more signs. Low iron. Iron, we need high stomach acid to be able to absorb iron. So chronic anemia is going to be like, there's so much connected to acid reflux. And even if they don't have symptoms of acid reflux, if they have all these other issues, we're going to be looking at improving their stomach acid levels. And that gets me to the fact that I actually have like a little cheat code for testing for stomach acid levels. It's not a diagnostic test, meaning for listeners, like it's not like an absolute, like it's going to tell you like a very firm number, but it gets you in the ballpark. And it's a baking soda test. Remember how we talked about baking soda and vinegar cause a bubbling effect? Well, a baking soda test is you drinking baking soda on an empty stomach in the morning. So usually first thing in the morning before you brush your teeth, drink coffee, things like that. You want to have an empty, because so the stomach's kind of just empty, not diluted with other liquids. You drink some baking soda and then you see how long it takes you to burp. And I actually have the exact recipe. I sometimes misquote it, so I've learned to stop saying it. Like the baking soda recipe, I have the whole recipe and just a free downloadable. If you go to betterbellytherapies.com/constipation. I know it says constipation, but the reason I even discovered this whole connection with like started getting into healing acid reflux was because I realized that stomach acid issues fuel constipation issues. So that's a story for another day. But betterbellytherapies.com/constipation, you'll get a free PDF that says like 3 natural remedies for constipation. And one of the remedies in there, it has a recipe for testing your stomach acid called the baking soda test.
That'll be one that we'll all have to try after listening to
It's
this.
super interesting. Yeah. So I actually have my clients, it's free, right? Like who doesn't, we all kind of want to be like, do I have to pay $300 for a test? If I don't have to, it'd be nice not to. This is a nice little way that we add on symptomology, like do they sound like they have low stomach acid? But other markers like do they have low iron? Do they have low calcium or osteopenia? But then also, you know, oh, okay, they failed their baking soda test, which like 95% of my clients fail it. It used to shock them. Now I think enough have listened to the podcast episodes that they're like, I think I have low stomach acid.
Yeah, probably if you're going to take the test, you probably have it, right? Because you're that
Yeah.
motivated to go
Yeah.
and try that out.
Yeah.
So when like going back to that the low zinc, this is something that like I know about, but you get caught in that cycle of okay, I have low zinc, so therefore I don't have as much stomach acid, and then that causes you to not absorb. How do we get out of that cycle?
I just make it super simple. I have my clients take betaine HCl and
Okay.
a zinc tablet daily until they can pass what I call a zinc taste test, which is like a little liquid you can buy. It's literally called zinc taste test on Amazon. I don't think you can buy it other places. I just like Amazon. Super easy. And so it's called zinc taste test. You buy it and you can put the liquid in your mouth. And if it tastes like water, like you don't taste anything, you're still zinc deficient. And if it starts to taste like something, you're getting better. And if it has a strong flavor of pennies, it'd be like a mouthful of pennies, then your zinc is getting to a good level. And here's another interesting thing. Zinc's a huge component of our flavor detection. And so a lot of my clients who like lost their ability to taste or reduced or altered flavor like perception after COVID or after illnesses and stuff, if they when they do this protocol without having H. pylori, of course, but betaine HCl and zinc, then they get their normal, flavor detection back.
Yeah, I work with a lot of moms for picky eating in their children, and zinc is something that is like low zinc is correlated with picky eating, and it's
Yes.
amazing. They take zinc
Yes.
for a while and they increase their
Yes.
levels, and suddenly their children are interested in more food. It's incredible. It's not the only reason for picky eating, but if that's one of them, it's a very simple solution.
I had a mom recently, her daughter was suddenly showing signs of like kind of anorexia. It was just super sad. And I don't diagnose that. So that's why I say it a little funny is because it wasn't diagnosed, but she was like eating just how much she was eating was just dropping. And she wasn't showing most of the psychological signs of like body image stuff that can be correlated with it. And I was like, give her some zinc. And then her eating went back up. It was like amazing.
Yeah, it is so amazing and so doable. Like we don't always have to go through complicated strategies and things that take a lot of effort, right? Just taking a little bit more zinc or getting a bit more into the diet.
It's like what I call is like elegant. And I really
Mhm.
find that like you really start to see that you're probably closer to the solution when the solution is easier and like more effective. Like this whole like I have to do all these really complex things to like put it on the plate exactly the way they want it so they're willing to eat it, or like make it cute shapes, which like cool, do that if your kid likes it. And there can be learning phases where they're like maybe they do associate like carrots didn't taste good. So there's like you have to work things out. But at the end of the day, health should be easy or we're still in disease, like dis-ease.
Yeah, I love that. Yeah, it should be elegant and easy. Yeah. So, in terms of other reasons for stomach, like low stomach acid, are there any other ones that you really work on, or did we cover most of them?
Low stomach acid is majority of the time it's going to be H. pylori and low zinc. Like, I'm trying to think. Um, Specifically low stomach acid. Yeah. I mean, that's what I really talk about, and that's what we solve for. And often when it comes to specifically low stomach acid, so not like the whole picture of acid reflux, but that low stomach acid, it really picks up once the zinc's there. One thing to note about zinc, though, sometimes zinc doesn't pop up as fast as other people, and I often find that there's hidden copper toxicity involved in those cases. So, hidden copper toxicity, there can be like a histamine component as well, where somebody, if they have a lot of bio unavailable copper in their body, copper is histaminic and also proestrogenic. So, they could have like a lot of estrogen dominant symptoms, and histamine itself literally creates more acid, like stomach acid and acid reflux. So, sometimes you have to back into getting like, you have to be patient on the zinc side of things because you also have to go and then address a hidden copper toxicity.
And do you have any strategies that people can look at for addressing, like reducing that copper? Because, yeah, zinc and copper are so, it's important to look at them together and look at that ratio. But what do we do about the copper? Because that can be a tricky one.
Yeah, so I didn't have this prepped, but there's a copper toxicity episode I really recommend. Episode 244. It's called "Is Copper Toxicity Behind Your Histamine Intolerance?" And so I'd come at it less from a stomach acid or acid reflux perspective in the title, but I am addressing histamine, which can be a driver for acid reflux. Um, and so I only say that because copper toxicity is a really big topic. But the first thing that we always do with our clients when they come in is we do something called an HTMA. HTMA stands for hair tissue mineral analysis, and we look at their copper and zinc levels on that test. Now, I do recommend that if you have an HTMA, you don't want to look for copper necessarily to be high because sometimes when it's low, that can be a sign that it's dominant in the body and it's pushing all your zinc out. So if the copper's low and the zinc is really high, basically I say like a 2-to-1 ratio visually. If you look at the numbers, the numbers don't correlate. But if you just look visually, if they're healthy on an HTMA, they'll be next to each other. But if the copper's low and the zinc is super high, that could be hidden copper toxicity. If the copper is high and the zinc is low, that could be what we call explicit copper toxicity, where it's like actually looks like what you would think it would look like. Um, Rarely are people copper deficiency and zinc excess are so rare that it looks very different on a chart. Usually it's going to be copper deficiency or copper hidden copper toxicity or just explicit copper toxicity.
And I think that this highlights why you want to work with somebody like yourself who really knows how to read these results so you can then work on a protocol that is actually addressing what's happening here rather than just looking at those numbers and thinking, oh gosh, my copper is low, so I just have to like get way more copper in my diet and that just
Yeah,
feeds
which
the
could make it
problem.
right, exactly, can make it way worse. And I cover in that episode 244 like what can cause copper toxicity, like types of health history things you can look at or other symptoms of copper toxicity. So, but that copper and histamine thing that can sometimes be involved in stomach acid issues where histamine really is driving like a high stomach acid response. Um, and usually, if there's histamine issues, you're also going to have, for a woman, hormone issues. So, really bad PMS, estrogen dominant symptoms, tender breasts, irregular periods, painful periods, cramping. So, which is what I know that's your bread and butter.
So the reasons for acid reflux, we've gone over more the mechanical, the low stomach acid, histamine. Are there any other big ones that you notice with a lot of your clients, or are those the main three?
Those are kind of the big ones, which is so funny to say after all these years. When I was first discovering them, I was like, wow, this is amazing. There's so many things that could cause it. But it starts to get smaller and smaller. There is one other thing I haven't mentioned explicitly, but it does drive some of the other issues I've already talked about, which is mold. Mold toxicity and mold exposure has been a huge driver. And of course, it's going to be more than acid reflux, but it can be one of the big ones. And so, there's a couple reasons why mold can cause acid reflux. Number one, mold, when we breathe it in, the mold spores and mycotoxins like the pollen, the like toxin that the plant releases, and the mold spore is the plant itself. Both of them can be irritating, but the mycotoxin is usually going to be more potent for somebody unless they're allergic to the spore. So the mycotoxins get into the sinus snot. We swallow our snot, which we naturally do. You don't have to be congested. We just have small amounts of fluid, like basically getting rid of dust and stuff that we accumulate. Our body's designed for that. But we swallow the mycotoxins, it gets into the gut, and now it can damage the gut. And one of the things it does is it damages what we call the myoenteric plexus. Myo is muscle, enteric is gut. Plexus is like it's controlling everything. That's how I like to tell my clients. And so it damages the control room for our gut, and it can make the gut's motility go down. So we're looking at bloating, we're looking at constipation, and we're looking at acid reflux. Because now the stomach might have enough stomach acid, but it can't mobilize. It has not enough motility. That's less of a mechanical issue now and more a neurological issue, so to say.
And with your clients, do you test for molds?
hmm Yep. Yep. Yeah. When our clients come in, we actually have a program where we teach you how to analyze these labs yourself and how to know which ones you need to do. It's called the Better Belly Blueprint. And in our module one, we have like a spreadsheet, which is like my brain dumped out onto a spreadsheet. And it just asks you all these different questions and you check a box, yes or no. And when you're done with that section for that lab, it tells you if it's relevant for you to do that lab based off your like symptoms and your health history. And so one of the labs we do is mold. And not everyone has that. Like it's not a part of everyone's story. I'd say it feels like it's more and more common. I don't know why that is in my practice, why I feel like we used to not have very many mold clients and now we have more, but um it's something we end up testing for. And so usually we're getting rid of the acid reflux before we even the mold situation's fully fixed for someone's body, because getting the stomach acid up, getting rid of adhesions helps so much. But if there is a mold component, it is kind of the full picture so that it doesn't come back. Because mold can also cause a lot of nutrient deficiencies, including the zinc. So that'd be another thing to consider. Is there something else causing leaky gut or making it hard for you to absorb nutrients? That could also set you up for low stomach acid.
Yeah. And could you tell us about a client that you've helped with the stomach acid? You've mentioned a few already, but like, do you have any other specific stories where
Yeah.
they've worked with you and yeah, things have gotten better?
Yeah, I would love to share about one. I actually have a podcast episode where he came and shared his story. So I have permission to share his name. His name is Don. And let me go and actually get his podcast episode. I knew I wanted to share about him, but I didn't get his number. Da, 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 da. I have a whole list, by the way, of all my podcast episodes categorized by topic. And you can go and get it for free at betterbellytherapies.com/get dash the dash vault, like a bank vault. Um, and so why am I not seeing his podcast episode? Let me go somewhere else. His name is Don, and sorry, I have a really hard time doing two things at once. betterbellytherapies.com/.
We're not meant to do two things at once, right?
No,
Multitasking
no,
is not actually a thing that is good for us.
I love it. Um, but we try. Okay,
Oh, we
episode
try.
200, episode 242, how he ended 40 plus years of diarrhea, stomach pain, bloating, acid reflux, and insomnia. Um, and if you think you can't get better, you got to listen to his episode. He's a client of mine who is in his 60s, I think, had been sick for, 40 years, majority of his life, and had Crohn's disease. So had kind of like an autoimmune where doctors are kind of like, you're stuck with this, good luck. and acid reflux. His Crohn's was actually in control when he joined the program. He joined for acid reflux. He could not get rid of this acid reflux. He wanted to get off his PPI. He wanted to be able to sleep like laying flat down on his bed. He wanted to be able to eat acidic foods and not have issues. And by the way, acidic foods is not the issue. It's just an aggravator. That's all. It's not like we are designed to be able to eat acidic foods, citrus, fruits, tomatoes, you have it. So he comes in and he's on at least one, it might have been two PPIs, morning and night. I do get confused with some of my clients, but I mean, it's very kind of simple. We took him through the H. pylori protocol. He had H. pylori. His wife also needed to do it because H. pylori is very communicable via spit. And so anybody you're kissing on the mouth is like a really high issue. Most of us in the US, we tend to wash our forks and knives and we don't share cups too often, except for maybe with kids. So sometimes in families, I will have like the parents do the protocol for their children as well, like a simplified children's protocol, so that the whole family gets treated. But yeah, he went through H. pylori, stomach acid protocol, and one of the things with him was that any of our clients who are on PPIs when they join the program, we typically say stay on it because I am pro symptom management. Like I don't want anyone being miserable or honestly damaging their body potentially by getting off a PPI prematurely. So he stayed on the PPI through the whole H. pylori protocol. And he even stayed on the PPI. This is a really interesting technique to do throughout early stages in introducing betaine HCl and zinc, because we could generally keep his stomach acid low but then increase it during meals. And that actually lowered his stomach acid even more, or lowered his acid reflux more, because at least he was digesting his meals. And then the real kicker for him, he kind of hit a plateau until he got a couple of visceral manipulation sessions. And so he was kind of like, hey, I really want to go off my PPI. I tried to go off it and it got way worse. And I was like, go get some visceral manipulation. And it was like 2 or 3 sessions. And he came back and was like, yeah, it's gone. I'm off my PPI for a month. And then he just kept building until he could pass the baking soda test and zinc taste test.
That's incredible.
Yeah.
I imagine that would have helped his Crohn's quite a bit as well.
Yeah, he recently, so we have a Facebook group for our students because he went through our like DIY like course option and then added on group coaching. So he wasn't like a what someone might consider like these direct clients where like they meet with me and I'm doing everything for them. We have an option for that called our Better Belly VIP, but he was just in our Better Belly Blueprint course. And I only mention that because sometimes I think people think, well, I'm too complex, I'm too broken, like that won't work for me. No, it's literally designed to work for everyone, including the very, very like the people who nothing else worked for. And so he was going through that program and he was in our group coaching portal on our private Facebook group. And just recently, he sent a message. I can actually pull it up if you just want to see it. I know no one else can see it, but he said that his calprotectin, which is a marker of intestinal inflammation, mostly in the large intestine, his calprotectin's been high for years, even with his Crohn's under control. All his Crohn's markers were low, but his calprotectin was high, and his calprotectin came back like in the tens, like digits, like super, super low. And so he's like, this is the first time in decades I've ever seen it he'd ever seen it low. And he was really encouraged. And he's months out of the program. He's not like actively doing any of our protocols. He doesn't have a super complicated diet or anything. So really, like when you heal the root cause of something, you might have some maintenance things you now do. Like we have some clients who can't eat corn for forever, but that's a maintenance thing compared to like a low FODMAP diet or like not being able to eat anything, which some of our clients come in with like 10 foods on their list. And we have a client right now who's like, I'm adding beans back into my diet and I can eat them. And like, and so he's able to eat acidic and spicy foods. He has no issues. His calprotectin's low. I mean, it's just really amazing to see.
That is amazing to see and changes so much for how you feel and what you can eat and where you can go. Like, it just affects so much of your life when you're feeling better in those ways.
Yeah. Yeah.
So, how can people work with you? Like you mentioned your program and how there's a VIP option and then the more do it yourself. Is that something that runs all the time, or are there certain
hmm
times throughout the year people can join?
No, right now it's all evergreen as of this recording, meaning like you can join anytime. We don't want it to be like I'm sick and I have to wait around for this to happen. Though I know some people's programs work better that way. So the Better Belly Blueprint, it is a DIY course. You can buy just the course, and we have people literally just get that because they are confident they can do it themselves, or they like don't want to, like, it could be a price thing, like they just don't want to add on the coaching, and then they'll email us and say, oh my gosh, thank you for your course, I just finished it, and like I no longer have headaches and my body doesn't hurt and my IBS is gone or whatever, like it's amazing. But when you buy the course, you can also add on group coaching for a 3 month or annual package. And then with our Better Belly VIP, I like to always emphasize the VIP is not to get better results. It is to either save time to have someone else do it, because I will take the method we have in the Better Belly Blueprint and I do it myself. You like meet with me one on one for a kickoff call where we determine what labs you need to order, which I already said that's the first thing you do in module 1 of the course, but instead I'm doing it. So it's just like less thinking involved if you're really busy, have a busy job. And then some of our clients will also do the VIP because they feel more confident with someone else doing it, maybe because of brain fog issues or things like that. But that's really a personal choice. And we've designed the Better Belly Blueprint to be accessible to all ages, all comprehension levels. It just kind of up to the person on if they want to do it with us. So, yeah.
Yeah, it's good to have both options because some people do want that more accountability and done for you, and other people are motivated to take it on themselves.
Yeah.
But
And we can give you links for those two things as well if people want to check out those offers.
yeah, I'll definitely put those in the show notes. And where can people find out more about your work? Like we'll have your podcast, and your program in the show notes, but could you just list off where people can find you, say on socials, or what your website is again, just in case people don't look at the socials, or sorry, on
Sure.
at the show notes.
Yeah, no, not a problem. So you can find us on the biggest place people like to hang out with us is on our podcast, the Better Belly Podcast. It's a top 1% global podcast. We also are on Instagram at Better Belly Therapies. And then you can go to betterbellytherapies.com for our website.
Okay, amazing. Well, thank you so much for coming on here and sharing your knowledge and for the work that you're doing. Like you're changing so many people's health and their lives because of it. So thank you.
Thanks so much.